So how do you manage patients with CCI, meaning craniocervical instability, and POTS, where exercise and mobility are significant issues? Do you focus on lower body exercises, for example?
So hard to give you a blanket comment on that. Just so for people who don't know what the symptoms of craniocervical instability are, they can include all of the things I mentioned. Lightheadedness, usually they have pretty substantial neck pain and headache. But one of the characteristic symptoms that people with ligamentous instability at the skull base have is they feel that their head is really heavy and unsupported. One of our patients was being teased that she was a bobblehead in her classes at school because she was often having to hold her head up like this, rest her head against a high back of a sofa, just anything else that provides a bit of support because the ligaments were too loose. Those patients often have worse symptoms when they're moving their head side to side or flexing or extending. The neck muscles can help counteract some of the ligamentous instability, but you have to work on isometric exercises with your physical therapist. They'll have you push against their hand and to strengthen the neck muscles, but it has to be done gently. It doesn't always work. And a big challenge for us is to pick which patients might need to move on to surgery to take care of stabilizing the neck. And because it's not well accepted everywhere, that can be a challenge. We often will try people in a hard cervical collar. Basically, if we can stabilize their neck movements, that tends to reduce the symptoms from this problem. And that includes wearing the collar even at night because we all move our necks around unconsciously in sleep. But as the questioner asked, if you're doing activities with those folks, you want to try and avoid anything that's going to aggravate the neck problems. So recumbent exercise, being on a recumbent bike often helps. Those kinds of things can be good, but also really rely on your physio.